helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. I'm Patty Cheek. Dr. Woolums back with us from Marshall Urology at Cabell Huntington Hospital. Good to see you again, as always. Now, one thing that we've been seeing popping up on air, there's commercials. They're all going on. They're talking about something called low T, and it's something that we do need to talk about, and people need to be aware. What exactly is low T?
Low T is low testosterone. Another name is hypogonadism, testosterone deficiency.
Now, the purpose of testosterone is?
Well, it's a male hormone, and it's used for muscle development, it's used for libido, it's used for hair growth. It's sort of what separates a man from a woman.
Exactly, and so having a deficiency in it is a big problem. It contributes to a lot of different things. What is a deficiency? What does that mean?
Well, low testosterone is a natural process of aging. So a man, as they get older, will lower their testosterone level. However, it is associated with certain metabolic syndromes, and so a low T can contribute to central obesity, to diabetes, to hypertension, to cardiovascular disease. Uncontrolled testosterone can affect the whole body.
And so that's what low testosterone can cause in your body on other objects. Is there anything else that causes it besides just aging?
Aging causes it, obesity causes it, smoking, use of marijuana, excessive use of alcohol, toxin exposure. If you're in an industry where you're exposed to a lot of chemicals, that may affect your testicles. So anything that affects the production of testosterone will affect the level of testosterone.
And when it comes to this deficiency, like we've seen, you've been talking about the symptoms, is there any feeling to it? What does it feel like? Would you know?
Well, low testosterone has a lot of the symptoms of being out of shape. A lot of men will complain of loss of muscle mass. They will complain of fatigue, hair loss. They just don't feel like getting out of the bed. And it's this whole metabolic syndrome that occurs when the testosterone level is low.
So regardless of what age you are, if there are some things that you just spoke about, if they contribute or they are what you are, you could definitely have low testosterone.
Absolutely, but I do think low testosterone is overdiagnosed today. I mean, some people are trying to find that magic bullet to make them feel better,
right.
And a lot of people are blaming it on testosterone. You have to be really careful about that. You can't forget that if you're out of shape and you're overweight, you're likely to have a lower testosterone level.
Right, and what are the ways of reversing this? Because you definitely don't want to do that if that's not the case.
You know, men come to me every day, look for that magic bullet. That magic bullet is exercise. Exercise, weight loss will help increase your testosterone. However, there are ways to replace testosterone. You can take pills, you can take injections, you can have implants, ways to increase your levels. Now, oral testosterone therapy, even these T boosters that you see on TV, are really not safe. And you have to be really careful, and that's a message I want to send out. But using injection therapy, using creams, topical agents are very effective and safe in order to increase your levels.
Okay, so the injections and the creams are definitely safer than the pills, you would say?
Absolutely. Pills can cause hepatocellular carcinoma or liver cancer, but we have to be careful about that. However, the one thing I want to talk about in terms of when you start T therapy replacement, you are always on it, because it breaks down or shuts down the ability of your own body to make testosterone. So you don't take starting testosterone replacement therapy lightly. Once you start it, you're always on it. And you need that controlled by a urologist or someone who understands testosterone replacement therapy.
Which goes back to the whole overdiagnosis thing. If you start doing something drastic like that, there's no going back.
You know, the thing that we have to understand is that fat cells take natural testosterone and convert it to estrogen. Well, estrogen is a female hormone. So if you have a lot of central obesity or fat around the waistline, that's converting your normal testosterone into a female hormone and making you feel fatigued and less energy.
Right, the exact opposite that you want to feel, and what most people feel if they do have this problem. And I want to touch on the fact that women can have low T as well, too.
Absolutely. We see women with low testosterone levels, and that affects their libido, their sexual desires. It can affect just, you know, their bone development at times. And for women, it's a little more complicated because it's a balance between estrogen and testosterone.
So if you have any questions, you can always just call Marshall Urology. Definitely
Absolutely.
a good place. You know, if you have any problems, concerns, if you need any more information, he's your guy.
Absolutely. Give us a call. Thank you.
All right, so that's going to do it for this segment in Moms Every Day. We'll be right back after the break. Just make sure that you go back to our website, WSIZ.com, click on that Moms Every Day tab, and make sure you download our app. We'll be right back after the break. Stick with us.